Good afternoon, everyone, and welcome to today's Global Health Rounds. My name is Stefan Bork. I'm an associate professor in the Department of Anesthesiology and Pain Medicine, and it's my absolute pleasure to introduce today's speakers. So today joining us is Susan Zhang and Jing Han. So Susan Zhang is currently a pharmacy student at the University of Alberta. This year, she collaborated with ECSSEN Career School Charity to develop and pilot a Chinese emotional support hotline that provides culturally tailored, supportive listening, crisis intervention, needs assessments, and resource referral services to the Chinese community in Alberta. Also joining us is Jing Han, who is a University of Alberta graduate who majored in psychology. She is current project manager of the hotline and a community culture broker with Action Dignity Society. So a big thanks to both of you for being here, and we're very much looking forward to your presentation.
Yeah, so hi everyone, and thank you to Patricia, Stefan, and the Global Health Rounds team for having us present on this topic and the initiative that Jing and I worked on this year. So as Stefan mentioned, Jing and I helped to launch the Chinese Emotional Support Hotline in Alberta this year. And so we really learned a lot from doing this project. And so the goal is just to share what we learned about with everyone today. So for the presentation outline, so first we want to raise more awareness around racialized communities' experience with mental health, including the contributing factors and their barriers and challenges. And then we will introduce some of the community initiatives, such as Action Dignity's programs and the hotline, that are currently working to overcome these barriers. And then lastly, we can have a discussion on what we want to do all together to overcome these systemic barriers.
Okay, thanks so much, Susan. And first of all, I would just like to gently make a disclaimer. As we're presenting our topic today, we are by no means saying that we are experts in any of these fields. This is strictly based on our work and our community members' feedback, and also the research we've done through this aspect that we present to you today. So first, I would like to introduce a portion of my research from being a community culture broker at Action Dignity Society. So at Action Dignity Society, for the Social Inclusion and Mental Health Initiative, we conducted community-based participatory action research to understand racialized and ethnocultural minority groups' barriers to accessing mental health services. What is community-based participatory action research? Well, from an ethnocultural minority lens, sometimes we feel stigmatized when research is based on theory and we're not involved in the process. To counter this feeling and to promote more usage of services after it's developed, community-based participatory action research is that when community members, the people who are going to use these mental health services, are involved in every stage of the planning of the research. So through this, we first want to scope the barriers they face, and then we want to scope, what are their needs, and then inform policies such as mainstream service providers and the government on their needs, so that when these policies and services are developed, community members understand them and will definitely use them. So Susan, you can go to the next slide. So for the research, it consisted of 5 to 7 participants from the Chinese, Ethiopian, Filipino, Latin, South Asian, South Sudanese, and Vietnamese ethnocultural communities. And we also plan to do more in the future. And then amongst all the community members, it was decided that they wanted to do a focus group for each of their cultural groups to understand the barriers and talk about some of the experiences they have encountering mental health services. Participants also signed the consent and confidentiality forms, and the groups were conducted over 2 hours where the facilitator took notes of what they said. So next slide. So here's some of the themes that were identified that were barriers to ethnocultural minority groups accessing services. And I will go into some details for the major themes that were among all cultural groups. Next slide. So for mental health findings, The first one that's very prominent is access to resource. A quote from the focus group is that social exclusion can manifest as a lack of culturally sensitive services. When community members go to services that don't understand their culture or don't understand their background, they feel like it's very hard for them to feel comfortable in telling them about their perspectives and what are their real needs. As well, sometimes service providers, community members feel don't understand that just because we're one culture, we're one ethnocultural group doesn't mean we're all the same because there's intra-group differences. We divide ourselves based on provincial, linguistic, and tribal regional backgrounds. We don't understand each other, which leads to assumptions being made in with our people. So within the group, there's also lack of understanding between mental health issues and the barriers they face because sometimes they're always grouped together. And this is very difficult for ethnocultural minorities to want to seek help. Finance, employment. Moving here, we didn't have any connection, relationship, or information. We're like a blind, moving around without any idea where we're going. Because of the immigration experience and also employment, there's a lot of times their credentials are not recognized. So yes, in coming to Canada, most of the time, they are selected and they are reviewed and they have very well established careers, but they gave it their all in coming to this country to start a new life. Yet because of this, their credentials are not recognized and they face struggles in finances, which really, really negatively contribute to their mental well-being. Next one. Education. There's no education about it, mental health, because in our community, you're mentally ill, you're considered crazy, and that's not the case. Although some community members do understand that mental health is very diverse, which I'll go into the next slide. But yes, there's still misconceptions about if any discussions of mental health occurs, it must be means that that person's crazy and there's going to be such a stigma, not only around that person, but also potentially burden that person's family and, people will look down and want to separate from them. So because of this fear, a lot of community members don't reach out for help. Language. Although there are programs in Calgary and resources that people can access, a big barrier is language. I would like to explain language as an immigrant, as a fish without water. Yes, you have capabilities. Yes, you have full conscientious and you know exactly what you want to convey. Yet because of this barrier, it's almost like you don't have air, you don't have oxygen, you don't have water, and you can't convey what you know that you can do and reach your potential. And that's very frustrating. Social. I have to give a credit to our community. We do have lots of things to improve our mental health, like our social interaction and spiritual life. So with this in mind, community members really hope that more services consider various aspects of their social life, the intersectionality of all these factors coming together in improving their mental well-being. Next slide. So as I previously talked about for education, a big misconception in ethnocultural communities is mental health equals mental illness. Mental health is actually somewhat a westernized term that, if we think about it, focuses on promotion of mental health being. Yet, for many ethnocultural minorities, it's really just equal to mental illness. So when you talk about these discussions, people automatically think of very, very severe diseases, and they don't think about, hey, mental health can be active exercising, can be sleeping well, can be eating well, and can be like physical wellness where like going to the gym, you can improve on. So with all of our programs, we really hope to promote and decrease the stigma of mental health and promote it in terms of positive factors so people are less afraid to reach for help. And also, especially in the Chinese culture, there's really a need to have face. By that, it means that we're really afraid of other people judging us. So when we're interacting with anyone else, we always want to put on our best sides and to show the best things we have. And if we suffer, we do it internally, and we feel it would be a burden to tell anyone else about our true feelings. So now I would like to help everyone understand a little bit about what exactly does a community culture broker do, and what does Action Dignity Society do. So next slide. So Action Dignity Society is actually known as the formal Ethno-Cultural Council of Calgary. We have over 200 grassroots and mainstream ethnocultural community organizations. And currently, I believe we support 50 to almost 100 ethnocultural groups. We really try to improve and embrace the following values, such as respect for diversity, equity and social justice, active citizenship and democratic participation, and collaboration. So we really try to show that within racial equity, inclusion, and cultural awareness in our policies and systems, we can address these systemic inequalities and reduce racism in public institutions, government, and service policing so that all ethnocultural community members can fully participate in economic, social, and civic life. Our current initiatives include expanding our reach to other sectors of our community, deeper engagement with faith communities, as sometimes for a lot of cultures, faith is a big part of their mental well-being, community consultations to identify gaps in services and initiatives and how to address these barriers. Like the CBPAR research, everything we do, we really try to gather it from the lens of our community members. As opposed to assuming what they need, we really try to first ask what they need and help them and let them take the lead in cultivating a solution in a strength-based manner. Increase collaboration with service providers. Currently, we've also previously worked with Alberta Health, Calgary Police, etc., to have more racialized minorities input in these factors. Strengthening the integration of arts and programs and design within and community engagement. Social well-being and mental health is deeply related to what things you like to do and what things in public allows you to interact with others. This is why we also focus on arts and community engagement. Next slide. So what is a culture broker? So a culture broker for Action Dignity is that we don't necessarily provide one service. We're not necessarily psychologists. We're not necessarily doctors. Yet we are community members who are embedded in each ethnocultural group so that we understand the community members' perspectives and we understand how to provide them with peer support so they feel comfortable in reaching out to us. And then through that, we are able to gather their opinions and their views and their needs and convey them to the system, like the public policy, institution, and services, so that we are accountable and then they are held accountable to represent the ethnocultural community needs. So in general, and community culture broker is someone that acts as a bridge between the community members so that they feel more comfortable in reaching out and accessing services. And also service providers are more aware of their needs and more conscientious when they try to develop culturally sensitive servicing. So I'm done this portion, and now Susan, go ahead.
Yeah, thank you, Jing. So to recap, I think that we can see that there is definitely a need to address mental health concerns for racialized minorities, particularly in a culturally sensitive manner. So now I want to introduce the project that we have been working on to help meet some of those needs, particularly in our Chinese community. So this would be the Chinese Emotional Support Hotline. So for this hotline, we worked on this project together with a nonprofit charity called Essen Career School. So this is an organization that provides a variety of social service programs to immigrants, particularly targeting the Chinese community here in Alberta. So we launched this hotline actually just this year in April 2021. And since then, it's expanded to 24/7 operating services. It's Alberta-wide, and we've also received support from the Alberta Health and the City of Calgary for this project. So what we do for this service is that we provide free emotional support, crisis intervention, needs assessment, and resource referral service. And the key part is that we aim to provide these mental health supports in a culturally sensitive way and in the Chinese language, so Mandarin and Cantonese for our callers. So apart from our mental health services, our hotline also provides food support. So we also provide direct registration or intake for a food program within our charity. And so this food program provides free donated food, mostly bread and bakery goods, to anyone that is in need or facing food insecurity. And this program is bilingual, so for those that speak Chinese and English. And recently, we've gotten several 211 referrals for this program. So I think a unique aspect of this program is that unlike many other food banks, we actually have over 100 plus satellite distribution locations across the city. So this really makes us very accessible to those that are in need. And currently we operate primarily in Calgary and Edmonton, but we're also starting this program in Lethbridge and Airdrie. So aside from the hotline and the food program, we also do several outreach activities. And it's because we realize that to really improve like the mental health of our community, we need to take a multifaceted approach beyond the hotline. So particularly, we wanted to do more to address the stigma around mental health in our community. So as a result, we also launched several outreach initiatives in conjunction with our hotline program. So this includes mental health webinars or forums that are provided in the Chinese language. We also write articles interviewing members of our Chinese community to share their personal experiences as an immigrant, for example. And then lastly, we also launched support groups on WeChat. So WeChat is a popular social media app for the Chinese. And these support groups are just a casual way for people to connect with each other. And it's also for us, it's also a platform for us to share resource-related information related to mental health topics. So I just want to talk a bit about the program development of this initiative, because with creating any type of new service in the community, we recognize that, it has to be a collaborative effort with the community, and we really have to make sure it's what the community wants or needs. So how do we identify the need? So there's kind of three areas where we found the need. So the first is that we know that there has been existing problems related to mental health for our community that has existed for a long time. However, it's especially because of the pandemic over the past year, it's just really exacerbated a lot of the issues our community was facing, and it just really urged the need for our service. And then the second point is that our organization also has many social workers and other mental health providers, such as those who are also part of the Chinese community. And when we consulted with them, their experiences have also told us the need for our service. And lastly, we also identified the need through hearing the direct voices of the Chinese community members themselves.
So I will just briefly go over some statistics. So this is just simply in Calgary, but keep in mind our Chinese emotional support hotline is actually Alberta-wide. So we welcome callers from all over Alberta. But just in Calgary, 2016 statistics show that there's almost 100,000, approximately 10% of the Calgarian population that are of Chinese ethnicity. And here are some of the barriers that specifically the Chinese community face, which we will go into about more in detail, such as financial difficulties, pressure from relatives back home, yet pressure from relatives over here to provide for them, discrimination, especially exacerbated, as Susan said, due to the pandemic, racial hate and crime, workplace challenges, and lack of social support and alienation. So now I will talk a little bit about the importance and need of this issue. Next slide, Susan. So since the start of COVID-19 pandemic, the proportion of visible minority participants, around 18%, who perceived increase in the frequency of harassment or attacks based on race, ethnicity, or skin color, was 3 times more than the proportion among the rest of the population, which means 6%. This difference was most pronounced for Chinese, which was 30% compared to other racialized minorities, around 18%. Those who reported Asian hate in Chinese were 34% more likely to feel emotional distress than those who reported their incidents in English. So that means because of the language barrier, when they discuss the stress in Chinese, there's a lot more stress and there's a lot more emotion because having really a portal so that they can speak their native language and discuss how their emotional well-being is very lacking in our services until we created the Chinese Emotional Support Hotline. And as well, Asian hate is not just a standalone issue, but it really contributes to worsening mental health of our community. Another statistics report that showed that Asian hate in Chinese were 34% more likely than those in English. And also amongst Asians, it's mostly the Chinese community that were receiving a lot of hate, at least initially. And then as well, because of the breakout of COVID-19, Chinese community members not only received perhaps prejudice from other ethnicities, but also from other Asian communities, because other Asian communities somewhat felt this hate was being experienced because of the location of the breakout, and because of that, it segregated the Chinese community even more. As a result, the past couple of years under the pandemic has urged the need of our services to be ever more culturally sensitive. Susan, go ahead.
So on the same topic of identifying the need, so here I just put some quotes from some of the social workers and other mental health providers in our community. So the first one is, through my work as a frontline counselor, I have heard from my coworkers and immigrant clients how thrilled they are when they can talk to someone who speaks their language. So I think that this quote, it shows that when we're able to communicate with clients in their native language, it really helps to build this unique connection, develop rapport, and open the conversation further. And then the second quote here is, as a social worker, I often wonder how to help the bigger community through collective efforts, how to get volunteers involved to support their peer community members. So I think this one shows that there's a need not just to provide like a service, but it's that we can also use the hotline to encourage peer-to-peer support, which is really important because this encourages our community's ability to help ourselves. So now that we've kind of gone over the needs, I also want to just highlight how our hotline was built to meet those needs. So I created this slide and I put the barriers of care beside the hotline goals because really these goals are aligned to overcome these barriers of care. So the first goal is that we aim to provide a mental health service that is culturally sensitive and in the native language, Chinese language of our callers. And then the second goal is that we want to improve the knowledge of our community regarding when, where, and how to seek help. So we provide a lot of resource referral services through our hotline as well. And then the third point is because we're 24/7 and it's also a free service, we aim to increase the accessibility of this mental health service for our Chinese community. And then the last point is that we really focus on early prevention of mental health and crisis issues. So for example, our outreach activities that are aimed to raise more awareness on these mental health topics is a type of prevention strategy. And then also, we really encourage like people to call, like not just when they're in crisis, but if they ever need to like talk about like their emotions or they need someone to talk to, because the goal is to have our service be accessible to them so that we can prevent those issues from escalating into crises. So a bit about the operations. So currently our hotline is operated by more than 100 Chinese-speaking volunteers. And these volunteers all go through training, and they're also supervised by those that have some backgrounds in mental health or social services from the organization. And then more details about our service. So one key thing is that we don't provide professional counseling since we are operated by volunteers, but rather we really aim to work with our callers from a person-centered approach. So what that means is that like we really recognize that providing like this mental health service, it has to be individualized. So we're there to listen to the caller. We talk through the emotions and the concerns they're facing, and then we work collaboratively with them to brainstorm coping and come up with an action plan. Okay, so now we're going to talk a bit more about the discoveries and learnings that we found from doing this project. So with the first point, I just want to start by explaining that like in the beginning, when we launched this hotline in April this year, actually a really big challenge for us was that we found that we weren't getting enough call volume. So the Chinese community, they weren't really utilizing our service. So this really caused me to like reconsider a lot of things. Like I questioned like what is the reason that people weren't accessing our service, and I questioned like does it mean that like the need is actually not there. So actually I found this to be not true. As our hotline progressed and grew more, we found evidence that in fact the Chinese community does need our service and that they do need mental health support. When they're not accessing a service or opening up about like their mental health needs, it means that other barriers are there. So for example, we have to recognize that like stigma around mental health is still largely present in our community. So what we did to kind of combat this, so in the beginning when we launched our hotline, we actually didn't have the food intake services. We didn't do any collaboration with the food program. It was later on when we began to do the collaboration with the food program. We discovered that a lot of our callers that called to register for the food, they also began to talk to us more. They began to build a relationship with us, and then it allowed them to start to open up about their mental health needs as well. So for example, actually some of the calls that we've had, we discovered that they were clients originally just calling to register for food. But then as they talked to our volunteers more, we would even like recognize some crisis situations such as like suicide or domestic violence that were occurring as well. So I think this all really goes to show that like building rapport is very important. And it's definitely a lot easier when our callers are able to talk to someone that share a culturally similar background and can speak the same language, which is what our hotline is trying to accomplish. And then with the second point, I just want to highlight that, you know, when we encounter someone that's more reluctant to talk about their mental health, it doesn't necessarily mean that they're not interested in learning about mental health and therefore it's not useful to provide like any education. Actually, we found that like for the webinars that we host around mental health, there is quite good engagement, which I think shows that there is growing interest from our community in learning more about this topic. So that this shows that, like there is hope through education and that we can help our community to understand more about mental health. So I think there is a caveat to providing this education though, which is that education, it works best when we tailor it to the needs of our Chinese community to really help them relate to what they're learning. So for example, we've done several webinars related to parenting topics because we really saw that this was a need from our community. So to understand this a bit more, many of the Chinese immigrant families, when they come to Canada, they often come by themselves without any other relatives. So as a result, many of them, they have to face the challenge of raising their children by themselves without the help from like any other family members, on top of many other existing stressors already, being an immigrant. So as a result, like actually many of these Chinese immigrant families, they've sacrificed a lot to raise their kids, including like aspects of their job or careers, to be able to stay at home and focus their attention on raising their children. So because we identified that like parenting is a major stressor in our community, that's why we decided to do several webinar topics on this as well. So the third point here, so we discovered that like the top reported reason for individuals calling our hotline is actually loneliness and alienation. So it really goes to highlight that like social isolation is a really prevalent issue that's currently facing our community. And then the fourth point is, so seniors are a particularly vulnerable population within our Chinese community. So at one point on our hotline, around 50% of our callers was actually from the senior population in our community. So that shows that there is a high demand of our service for seniors. So to understand this a bit more, seniors, they have comparably a lot more barriers and risk factors around mental health. So for example, they have a significantly greater language barrier. And a lot of these seniors, they also face difficulties with mobility issues, and they lack vehicles, which creates a lot of challenges in their daily life activities, including like grocery shopping and getting food. Which is why actually our food program has a lot of seniors, because this is a group that's also more vulnerable to food insecurity. And then the fifth point here is that, so our hotline, we also receive a lot of calls from those who are seeking resources. So some of the common areas we notice for resource needs pertain to legal resources, healthcare resources, and mental health resources. So particularly a lot of our callers, they often do know like the mainstream services that exist, like for example, Legal Aid 211 or Distress Center. But when they call our hotline, they're specifically looking for resources according to their like cultural or language needs. So for example, a lot of them, they're looking for clinics that have Chinese speaking doctors, or psychologists or counselors that speak Chinese. So I think when we provide these resource referrals, we really have to think about and take into account like their cultural and language needs as well. And then I just want to make a note about language. I think we also have to recognize that the Chinese language is quite diverse. There's Cantonese, Mandarin, and then there's also many other dialects as well. And all of these different dialects are very different from each other. So when we refer clients to these resources, I think it's important we notice that there are multiple different kinds of Chinese language.
And going to reiterate our previous point, the Chinese community is diverse and has diverse needs within itself. I think for all ethnocultural community members, we have to recognize that the diversity within the population and each population have different concerns. such as for the seniors that Susan previously described who face mobility issues and usually came here at an older age and have less social connections and network, and are struggling to use technology, which worsens their ability to communicate with people in this modern day of the pandemic. And yet there are also youth who Susan previously talked about. Child and parenting is really important. Youth who grew up in this Canadian environment have different cultural values that are passed from the society that they understand, and sometimes it can conflict or it can be different from their family values that are traditionally more Asian. And because of that, in communication between parents and youth, there could be conflicts and affect both the parent and child's mental health. As well, there's international students who grew up came here to Canada at perhaps 18 when they're adults, yet through schooling, they learn all these different new values, and living in this new environment, they start to develop a higher sense of self-awareness and question who they are as well. So within all these different populations, they all have different needs, and hopefully in future servicing, and such as through our webinars, our diverse range of volunteers who've undergone through training, etc., and future other services, we can all not just look at the ethnocultural lens, but we can look at different ethnocultural experiences due to age, gender, and various other cultural factors. Number 7. Our volunteer programs are also an important way to improve our community's mental health. So many of our volunteers are actually members, and they are all members of our Chinese community who also might be in some way vulnerable as well. And by that, we mean that perhaps, their English skills are lacking, and that's why they want to volunteer for the Chinese Emotional Support Hotline and help others in Chinese. And a lot of them, or at least a portion of them, are new immigrants who recently arrived in the last 2 or 3 years that didn't have really a good chance to establish a network of social connections and peer support, and then the pandemic happened. So with this, a lot of them hope to volunteer so they can establish a more strong support network. And as well, some of our volunteers are, due to the pandemic, were laid off and unemployed, and thus they have come to the hotline to try to contribute in a meaningful way. And with more community members being our volunteers, we're also normalizing the discussion of the mental health. That amongst these people, there's a lot of people who are interested, and there's more people who can go past to their family and friends and convey what mental health is in more positive terms, as opposed to previously stigmatized, being very sensitive and a taboo. Our volunteer program is truly unique, and that creates a community of members who speak the Chinese languages and also share the same cultural background. And so with this, we overcame the language barrier and also gave immigrants more meaningful opportunities through volunteering experience. And through this, they gain more sense of self-esteem and self-confidence, and also more guidance, a community of supporters for their future endeavors. So moving forward, here are some of the recommendations that we've gathered from the community members who participated in Action Dignity Society events and told them to our community culture brokers, and also some advice that we have from engaging with volunteers and also community members on the Chinese Emotional Support Hotline. The first is that specialized mental health education for each ethnocultural community is needed. Simply creating something to be, this is culturally sensitive, and throw it as this is done is not enough. There really needs to be special targets and more understanding of each cultural struggles, each cultural strength, so that practitioners can support them in meaningful ways and build their resiliency. As well, the need for more mental health professionals that can speak native languages. As we previously talked about, language barrier is a huge concern. Sometimes it's a barrier that is very hard to overcome, let's say for seniors who came here at a very mature age. And so with these, they have less social connections to practice language. So it really means that as practitioners or mental health services, we should be more proactive and accommodating to their needs. As we understand with mental wellness, a big portion of it comes from able to express ourselves, our true feelings. If we struggle with the basic words, then it's really hard for us to understand and dig deeper and want to dig deeper to express how we truly feel. Another thing is integrate translators into current mental health services. We understand that sometimes we don't have the ability to cultivate a significant portion of mental health professionals that can speak each native language. In this case, we hope more services can use people such as community culture brokers or other culturally sensitive translators into these integrated services. As well, we noticed that in talking with a lot of service providers that a lot of times, yes, they do provide translators. However, it's not readily accessible. And as well, it's not usually promoted or visible on their websites. So with that, it really prevents our minority members from knowing and also wanting to reach out for their services. Recognize and support non-Western practices that promote good mental health. Like I previously mentioned, spirituality, culture, traditions, arts, and well-being are deeply integrated into our mental health well-being. So with that, we hope to the policies and also services recognize more of these culturally grounded practices, and that can help us increase our mental well-being in different sectors of life. As well, like I reiterated with the community-based participatory action research and the Chinese Emotional Support Hotline's establishment process, we hope to design more future programs with racialized minorities incorporated into the process, as opposed to designing it and then releasing this program and racialized minorities then giving feedback of, hey, I don't want to use it because you did this, or I don't want to use it, I'm not sure of how to use it because of these factors that weren't previously or could have been addressed beforehand. Susan, go ahead.
Yeah, so near the end of our presentation, just want to go over the contact and resource information, like where we can find our services. So we're listed on Inform Alberta. So if you just search Chinese Emotional Support Hotline, you will be able to find our information here. And then for the food program, it's also on Inform Alberta. So the name is called the Loving Heart Food Delivery Program. And then if you go into the page, you can see that it's connected with our hotline. So to register for the service, our hotline acts as an intake point here. And then Action Dignity Society is also on Inform Alberta. And so their agency is here, and then they have several different services listed within their page too. And then, yeah, so for the hotline, we're always looking for volunteers on an ongoing basis. So if you can speak Chinese, or if you know anyone that can speak Chinese, you can always encourage them to reach out to us. So our email is here. And yeah, Jing, do you want to explain a bit about the application for the Action Dignities volunteering?
No, it's fine. If you guys are interested, I'd just like to let everyone know that currently Action Dignity primarily focus on the Calgarian population. However, there are similar cultural broker firms within Edmonton. So depending on your population's needs, you can always contact these services. And as I previously talked about, as community culture brokers, we don't provide direct professional servicing, but we really are someone that the community members, you can provide our contacts, and we understand their needs and will help them find the culturally sensitive servicing that best suits them.